Thank you. The next question, which I think will be our last, if I'm computing the time correctly here, is on tobacco prevention. Since 2009, when the Tobacco Control Act was passed, the FDA has been authorized to regulate the manufacture, marketing, and advertising of tobacco products. Through this authority, the FDA has been able to limit harmful marketing activities that target youth, such as the selling of flavored cigarettes. These new restrictions have the potential to prevent an estimated 10 million children from ever picking up their first cigarette and therefore saving thousands of lives each year. Steve, starting with you, do you support and would you protect the FDA's authority to regulate tobacco products?
Thank you. Will there be closing statements, or will this just be the final?
Final round.
But then there'll be closing.
1 minute closing.
Fantastic. I have a confession to make. And it's a serious confession, and it's something that I feel bad about. 22 years ago, I worked for Big Tobacco. I am serious. It is a confession. And it wasn't intentional. I was hired as a director of sports marketing for Miller Brewing Company, which at the time was owned by Philip Morris. So I was in Atlanta, and they offered me this great job, and I was going to oversee national marketing for the NBA, and then later I went through a bad period where I became an NBA agent, a Major League Baseball agent, but that's for another story, another day. So I accepted the job to work with Miller Brewing Company as director of marketing. I didn't intuitively believe that that was connected in some way to tobacco. But on my first trip to the home office in Milwaukee, you walk into the lobby of Miller Brewing Company, and there was a bar tap that was live, and you were encouraged to have a beer, which at 9 a.m. just always struck me as odd. But there were bowls of cigarettes sitting there in the lobby, and it bothered me. I think tobacco is insidious. Over the years, I've written articles on tobacco use, and I wrote an article about 15 years ago, and I said then, I believe it now, that hundreds of years from now, when we have perspective and distance to look back on our civilization now, there'll be two areas that future generations will say, that was insane. One is tobacco use. The second, I believe, is boxing for not the sport, but the neurological impact. You know, there's 60 concussions given in one boxing match, whereas Tom Brady falls down and the whole world goes, oh, is Tom okay? But it's a socioeconomic thing. But boxing and tobacco, I believe, they're an affront to our idea that we're a civilization, that we tolerate that. And obviously, if it was proposed now, the FDA wouldn't approve tobacco. So I do support the strongest legislation. I support getting out the $500 million of promotional materials that are in retail stores all across the country. Whatever we can do to stop tobacco, because I think hundreds of years from now, it won't exist. You know, it'll be incremental. It'll happen from taxes.
Steve, you're over time.
But I hate tobacco, and I'm sorry that I worked there.
Danny?
I have a confession to make too. And I don't think my mother knows about this, so hopefully you won't pass it on to her. But when I was in the second grade, I was in a dugout with some friends of mine, and we smoked a pack of cigarettes, and I got sick. And I never smoked after that. And one of the things that was perplexed me since I was very young, maybe a little bit older than that, is why is tobacco still commercially acceptable? Why is that not illegal to commercially sell tobacco? I don't understand that at all. But I can give you the reason why, is because our political system cannot stand up to these major lobbyists and big tobacco. I worked in investigation when I was in DEA in upstate New York, and what it involved with was a multi-agency task force. And it was about smuggling cigarettes to Canada, bringing illegals in, the drug trafficking, Hells Angels, all that kind of stuff. Okay, it's a vice. Our government should not be involved with a vice to earn tax dollars to pay for things like child health care. It doesn't make any sense to me. It's hypocritical. We need to stand up to these big tobacco industries and get rid of it. Just get rid of it. I'm all for everybody being committed to making sure that we just make it illegal. There's no reason why marijuana should be illegal and people going to jail for it, which I describe on my website, and I'm totally against that too. I think that should be decriminalized. And I was a drug agent for 12 years. You're going to go to jail for smoking marijuana, some states medical marijuana, but big tobacco can make billions of dollars by killing our citizens and spreading it around the world. That doesn't make any sense to me. So, and as far as the Family Smoking Prevention and Tobacco Control Act, that's great. I like to see this incremental thing done, and everything sounds practical, and everyone says, hey, you have to be practical. Guess what? When it comes to principles and people's health and safety, you have to be practical. And when it comes to flavored cigarettes, you know what they had? They had a caucus that made an agreement not to include menthol cigarettes. Is that a flavor or not? I'd like to ask you. Okay, thank you so much.
Cynthia.
Well, I have a confession to make too. I might vote for Steve Woods. No, seriously, I do support the FDA authority to regulate tobacco, and I applaud the President and members of Congress who were able to get that done. And I think I think in this room probably know why it's important that we regulate tobacco. Clearly there are chemicals and additives in cigarettes that should be disclosed so that users are fully aware of the risks they're taking when they're using those products. And I believe that there should be a healthy regulatory environment to balance the needs and rights of citizens against the unbelievable undue influence of large corporations. I think it's an appropriate role of government to protect consumers from the profit motive, this never-ending quest to make more and more and more money, regardless of health outcomes or the impact negatively that it might have on communities. And I think that's at stake in this election. It's not just whether I support the federal government's ability to regulate tobacco, I do. But it's also clear what's going on in Washington, okay? Whether you like it or not, all these great independents on the stage, yes, they have a variety of perspectives and they're independent and they claim no allegiance to a party. But it is the Democrats and it is President Obama who is protecting kids, I think, more than the Republicans from tobacco, from also trying to fund the Fund for Healthy Maine, also taking steps to responsibly regulate corporations and promote healthcare. I mean, we did pass the Affordable Care Act. It was an initiative of the president, passed by the Democrats. So these aren't just philosophical decisions, and it's simple to say that, oh, it's the party system at fault. But when it comes to actually getting things done to promote health and to regulate responsibly tobacco, I think we need to support President Obama, and we need to make sure that he has someone in the United States Senate who's got his back.
Andrew.
Well, guess what? We finally reached an issue which I'm going to disagree with everybody on here. I think that it's a legal product and the federal government has no right to tell people what they should put in their bodies. We should educate, not regulate. However, when it comes to children under 18-year-olds, I perfectly understand that. However, it should probably be a matter for the states, not for the federal government. However, banning tobacco, first of all, in a bad economy would make no sense. How about all the people employed by tobacco farmers? Secondly, it's also a cultural product for this country. Tobacco's been in this country since before we were here. And I fundamentally find it offensive to have people saying the federal government should ban a legal product because they don't like it. Now, fine, make sure that they don't advertise to children. But I smoke cigars, I have the occasional cigars, and I don't want the federal government telling me I shouldn't. I do not think tobacco should be made illegal. I think marijuana should be made illegal, and I think the government should butt out of adults' right to self-medicate, because nowhere in the Constitution it says we have rights. If we have no rights to individual sovereignty and the sovereignty of our bodies, we have no rights at all. Thank you.
Angus.
I'm going to add one more to Steve's list of things which we're going to look back on 50 years from now and to say what were they thinking. One is tobacco, the other is boxing. As he said, I would add campaign finance. We're going to look back on the system and say what were they thinking. Yes, I think the FDA should be able to regulate tobacco, no issue. But I want to talk a bit about my own history with tobacco, in part because Charlie Summers yesterday attacked me in a debate, or I guess the morning before last. He does go to some. He just doesn't like healthcare people. But he was there, but he attacked me for raising the cigarette tax. Guilty. I raised the cigarette tax in 1977. It was specifically designed to make cigarettes more expensive in order to drive down teen smoking. And what he didn't mention is we lowered the income tax in the same bill, so it was revenue neutral. It wasn't a money raiser for the state. The whole intention was to drive down teen smoking, and it worked. We were one of the highest states in teen smoking, and 5 years later we were one of the lowest. The other piece that I'm very proud of is when the tobacco money started flowing into the state, Maine was the #1 state in the country in the utilization of that money for health care and tobacco cessation. Finally, I've got 40 seconds. I'm announcing an initiative. Massachusetts undertook a comprehensive tobacco cessation program amongst their Medicaid patients, which has worked dramatically. I propose that this become a national program funded by CMS through the Medicaid program, optional for every state, Medicaid cessation services for every Medicaid recipient. In Maine, 40% of our Medicaid recipients are smokers. The savings in Massachusetts has been over $2 of savings in healthcare costs within 3 years in exchange for $1 invested. I think this is an opportunity that we have to really make a difference in people's lives, cut the cost of healthcare. In Massachusetts, heart attacks went down 46%, coronary heart 49%, non-specific chest pain 32%, dramatic savings right away. There's a payoff for it in terms of Medicaid expenditures, and I think it would be a great program for the entire country.